Good morning and welcome. My name's Rachel Browner. I am the program coordinator for OneOp, and it's my pleasure to welcome you to today's session on Medicare 101, Simplifying Enrollment and Benefits. In case you're joining us for the first time, I'd like to give a brief tour of our webinar platform so you can find your way around. Hopefully, you're currently able to view the slides that we're sharing. If you're unable to see them or have any other difficulties, please email us at contact@oneop.org, and I'm going to be placing that link in the chat as we speak. As some of you have already done, we look forward to having you join us in the chat pod for conversations and questions. To embed that chat pod so you don't miss any links or conversations, simply place your cursor over the shared slides. From there, you'll see a toolbar pop up across the bottom of your screen, and just click that chat bubble icon. So when typing questions or comments, please be sure to select the Everyone from the Response Options drop-down menu so everyone's able to view any responses in that chat pod from you. And please note that the slides and resources are available for download on the event page for today's sessions. And we'll be covering continuing education information at the end of the webinar, so please stay tuned at the end if you're interested in continuing education credits or a certificate of attendance. And finally, closed captioning is available for this webinar, and you can turn on the subtitles via the Zoom toolbar. If you haven't already done so, let us know where you're joining us from. It makes this platform a little bit more personable, and you can type in the chat, again, making sure you select the everyone options from the drop-down menu. If there's more than one of you in your office, let us know. It just makes, again, this platform a little bit more personable. I'm actually located in College Station, Texas. Looks like we have some folks from all over, from Indiana, Idaho, Kansas, Virginia. I love to see all of us in the diverse groups and different states that we're located in. So thank you for that. All right, so thank you for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their families. I'd like to introduce our presenter today. You may recognize him if you've joined us for other OneOp webinars before, but we're pleased to have Mr. Andrew Crocker. He is very well known in Extension for gerontology and health. He is an Extension program specialist with Texas A&M AgriLife Extension Service, and his focus is on health and well-being of older adults. One of his main roles is really to support county extension agents in the state for family and community health in their efforts to educate older adults, caregivers, and the professionals who serve them. And since joining AgriLife in 2003, Mr. Crocker has worked to develop resources to help older adults improve the health literacy through communication with their health provider and better medication management, navigating the internet, accessing reliable health information, and provide information referral to grandparents rearing grandchildren. He also works a lot with individuals with disabilities, and does a lot surrounding Medicare. So we're excited to have Mr. Crocker on today presenting. And so without further ado, Andy, do you want to go ahead and take it over?
Sure. Thanks, Rachel. Good morning, everyone. My name is Andy Crocker, and as Rachel said, I'm an extension program specialist with Texas A&M AgriLife Extension Service. And since you're all telling me where you're from, I'm in Amarillo, Texas. So that's way up in the Panhandle. And I'm actually closer to Denver, Colorado than I am to Dallas. So, um, it's high here, it's dry here, and we actually get snow here. So, I'm looking forward to some cooler temps that are on their way and um, kind of a change of seasons here. We're going to talk today about Medicare. I always feel like when I talk to or do a session like this, it's like that song from Smokey and the Bandit, where we got a long way to go and a short time to get there. But we're going to do a high level overview of Medicare. We're going to talk about some of the coordination of benefits issues that you may encounter as you work with older adults who may be separating from active duty service and engaging in TRICARE for Life. And we're also going to actually start with some of the changes for 2025. Kathleen, Amarillo is a great place to live, and I'm glad your dad and brother are up here with me. Also, I have the chat pod open, so if you've got questions as we go along, please put them in there. I will try to answer based on our time here together, and if not, we will follow up afterward and get you the answer that you need. So, as I mentioned, we're going to talk about changes in 2025. We're going to do a high level overview of Medicare basics, and then we're also going to talk about coordination of benefits. So, what's new in 2025? So, the Medicare program year will begin January 1st, 2025. So, the things we're going to talk about today, some of them aren't going to be available till then. And this slide is kind of some of those main things that will go into effect after the first of the year. So, Medicare, kind of for the first time ever, is going to introduce some caregiver support. They're going to introduce a respite benefit. For persons in hospice. So the beneficiary who's in hospice, who is being cared for by a person, and that person needs respite care. Medicare will have some benefits available for respite care, but again, kind of limited. It's a start, but it's kind of limited. It is um, uh, isolated to individuals on hospice. So that's a step in the right direction. Caregiving is a big concern for a lot of older adults. And respite care is a very needed benefit for those caregivers. And so that's a good step in the right direction for Medicare to start providing some of that respite care. As a side note, there are other opportunities for respite available in your community through the area agencies on aging and other sources, and I can talk to you more about that after if you're interested. But this is the first time ever Medicare's kind of had that benefit out there and available to caregivers. The other is caregiver training. And so again, the Medicare beneficiary is the it's through Medicare Part B, and the Medicare beneficiary has to designate their caregiver, but Medicare will provide training based on the medical needs of the beneficiary. So if you need help with, say, um, administering your medications, or if you need help with some of your other activities of daily living, such as toileting and transferring and things like that, Medicare will pay for training that is directly related to the health needs of the beneficiaries for a caregiver. So these are some exciting changes to the program that are coming about again to start January 1st, 2025. There will also be expanded access to mental health. So, licensed marriage and family therapists, addiction counselors, and other professional counselors will be able to bill Medicare for their services. So, older adults who are Medicare beneficiaries will be able to choose um, a licensed professional counselor or a family therapist in their community, and Medicare will provide payment to those professionals for their services. As provided by Medicare. There are some changes to telehealth coming down the pike. So during the pandemic, Medicare kind of threw the doors open on telehealth, and you could do a visit with your health provider from your couch in your robe, and do that as much as you wanted or as much as you needed. But starting January 1st, 2025, telehealth visits will have to take place in an approved telehealth facility. Okay. And you may be thinking to yourself, well, what does that mean? Well, you don't drive very far out of Amarillo before you get very rural very quickly. And there are telehealth facilities. They're not clinics per se, but they are designated rural health telehealth facilities where you can go and the electronics are all set up. They may range from like an office to something that looks kind of like a phone booth. And you can go in there and have telehealth appointments with a provider. And so starting January 1st, no more couch and robe. I guess you could still wear your robe down to the telehealth facility, depending on where you live and the condition of your robe. But you will have to have that appointment scheduled in an approved telehealth facility. The last thing that I kind of want to highlight that's going to be new in 2025 deals with Medicare Part D. D as in David, your prescription drug benefit. Under the Biden administration and some of the work that they've been doing with reducing the costs of prescription drugs, um, they are attempting to close what has lovingly been known as the donut hole. And that's that coverage gap in your prescription drug coverage with the goal of phasing it out completely over the next few years. And so starting in 2025, your Part D out-of-pocket maximum, so the maximum amount that you will pay out of pocket over the benefit year will be capped at $2,000. And that includes your deductibles and co-payments, but it does not include your monthly premiums. So almost every dollar that you're spending on prescription drugs will count towards that $2,000 out of pocket maximum. Um, and then another thing that may be of interest to some of the people you work with is that Part D plans will have to offer an option to spread payments out over 12 months. And so this is with an eye toward people not getting sticker shock at the cash register at the drugstore or wherever they're picking up their medications, right? It's akin to like the electric company providing you average billing for your electric bill. You'll be able to spread payments for prescription drugs out over 12 months in hopes to kind of normalize and stabilize some of those wild swings that you may experience when you go to pick up some of your prescription drugs. So these are the big things for 2025. Get excited. I'm excited. And some great new benefits out there through a really great health program. All right, so now that we've kind of talked about what's new, let's talk about what's not changing, right? Like what we all know and love as Medicare. So Medicare is a federal health insurance program for individuals 65 and older. And that's how we normally think about Medicare. But it also is available to certain individuals, regardless of age, if they meet certain conditions. And so some of those conditions are amyotrophic lateral sclerosis, which we informally call Lou Gehrig's disease, end-stage renal disease, and people who meet Social Security disability insurance requirements. So these people are able to join Medicare no matter their age. So while we typically think of Medicare beneficiaries as being older, and now that I'm thinking back to what I just said in the previous slide, I even said older adults, but we should more correctly term them as Medicare beneficiaries because they can be any age. It's just we normally think about the program for individuals 65 and older. It is administered through the Centers for Medicare and Medicaid Services, which is the largest health payer in the United States between Medicare and Medicaid, which we'll talk about in just a minute. They are different programs, even though they're kind of housed under the same agency. And then enrollment for Medicare takes place through the Social Security Administration. And Medicare and Social Security talk to each other about benefit determinations. You'll see that in a little bit when we get to talking about extra help. And so uh, don't be alarmed when you get your kind of welcome to Medicare packet and it encourages you to go to Social Security to sign up because that's how the system determines the benefits and then they hand you off over to CMS. So when do we enroll? Well, generally around your 65th birthday. So there's kind of a 7 month window. It includes the 3 months before you turn 65, the month you turn 65, and then the 3 months after you turn 65. Okay. So my birthday is in January. I'm an Aquarius, in case you were wondering. Um, I would be eligible to sign up right now because my birthday is in January, the month I turn 65. So if we count back December, November, October, I'm in the first month of my eligibility. And if I sign up before the month I turn 65, on the first day of that month, I will uh, be eligible. Okay. So if I sign up today, January 1st, 2025, I will have my Medicare benefits in place. If I sign up in the month I turn 65 or the 3 months after, my coverage will start on the first day of the month after. So if I wait and sign up in January because I don't want to ruin the surprise, right? Like I want to make this excitement last. Um, then my coverage would start on February 1st. So keep this in mind. It is very important that you enroll, if eligible, during your initial enrollment period, because there could be penalties associated with not enrolling when you're first uh, eligible. And that's particularly related to Part B. B is in boy. But there are some exceptions to that, and we'll talk about that when we get there. So get excited. Uh, the 3 months before you turn 65, the month you turn 65, and the 3 months after. So I see a question about the respite care is in the home and not, or in the not in the home, inpatient only, correct? So the initial draft of that rule that I've seen, yes, it's inpatient, but stay tuned because final determinations for a lot of things aren't out yet. It seems like there has been some lag this year, and well, you'll see that in a bit when we start talking about costs of coverage, because even some of the costs for coverage aren't published yet. So uh, stay tuned on that. But yes, inpatient is what I've seen in the preliminary rules. Uh, Liz, if you sign up in the month you turn 65, your coverage starts on the first day of the month after. So if you're again, if I sign up in January when I turn 65, my coverage would start February 1st. Um, Luann, you should start getting communication from Social Security and Medicare in the months leading up to turning 65. So Medicare usually begins related to disability because again, SSDI is associated, or you can qualify for Medicare after you've been on SSDI for 24 months, unless you have ALS, and then Medicare begins the first month you're entitled to SSDI. So that generally means that you get Medicare on the 30th month after you become disabled. So there's a 5 month waiting period to get SSDI benefits, and then that's followed by a 24-month waiting period for Medicare. And if you have more questions about Social Security disability insurance, we had a great webinar a few months back from somebody with Social Security telling you everything you ever wanted to know and more about SSDI, and I would commend that to you. You can find that on the event pages. But just know that while individuals who qualify for SSDI also qualify for Medicare, there is a lag time there. The benefits don't begin immediately unless you have Lou Gehrig's disease. So I've already mentioned it, and now we're going to talk about it a little bit more, but Medicare and Medicaid are different. Um, and it doesn't help that the Centers for Medicare and Medicaid Services is kind of lumped together, but they are different programs. Okay. So Medicare is a national program that's pretty consistent across the country, especially if you're enrolled in Original Medicare. It's administered by the federal government. It's health insurance for people who are over 65 and for people who have certain health conditions. And it's the nation's largest payer of inpatient hospital services for individuals with disability, older adults, and people with end-stage renal disease. Medicaid is a state and federal partnership to provide health insurance for people who meet certain income and asset requirements. Okay, so Medicare, CARE, older adults, it's a federal program that's pretty consistent. Medicaid, CAID, is a state and federal partnership for which you qualify based on income and assets. So I'm going to pause for a minute and just let that sink in for a second. So it is administered by state governments in federal rules. So qualifications for Medicaid are going to vary by state. Um, and it is the nation's primary public payer of acute health care, mental health, and long-term care services. And I want to focus a little bit on that last one, long-term care services. A lot of older adults and their caregivers believe that Medicare, CARE, will pay for them to be in a nursing facility. that is not the case. Medicaid, CAID, pays for long term care services. That is a nursing facility. Okay. And in Texas, Medicaid pays for something like close to 70% of the nursing home beds in the state. So it is a very large program that provides an essential service to a lot of vulnerable people. But please note that these are different programs with different requirements and they pay for different things. So Medicare is not going to pay for you to be in a nursing home if you need it. Medicaid is that program, and you have to meet income and asset requirements in order to qualify, and those requirements are going to vary by state. And I see Rachel has put a link in the chat to the Social Security retirement webinar and also the Medicaid webinar in there so that you can learn more about those programs if you have interest in them. So there are different parts of Medicare and they do different things, and we're going to talk about all of them. So Part A is your inpatient hospital insurance. Part B is your outpatient medical insurance. Um, Part C is what's known as Medicare Advantage, which we'll talk about briefly here in just a second. And Part D is your Medicare prescription drug coverage. Hang on with me, military folks. I did a session on this for Joint Base San Antonio, Lackland, a few weeks ago, and one of the comments that immediately came in said that civilian health insurance is so complicated. And there are parts of it that you do feel like sometimes you need a map and a flashlight, but I got your map and flashlight right here, and we're going to take you through each one of them. And I don't want anybody to be intimidated. So when you choose Medicare coverage, you'll have a choice. You can choose a original Medicare, which is what we think of as Medicare Part A and Part B. And you go on about your day. It operates like we think Medicare does. We also have the option of a Medicare Advantage plan. And a Medicare Advantage plan bundles all of your benefits and they're offered through a private health insurance company. Okay. So original Medicare operates just like we think it does. Medicare Advantage operates through a private health insurance company. And so many of you who turn on the television and in between the political ads these days, you probably have seen Joe Namath or Jimmy JJ Walker trying to convince you to call this number and sign up for a Medicare Advantage plan. That's what that is. It's all the benefits available under Medicare, but it's offered through a private insurance company. Now, the thing about Medicare Advantage is they may, and I'll stress may include additional benefits for you. So they may include something like vision coverage because Medicare, original Medicare, doesn't pay for, say, routine visits to an optometrist. Medicare Advantage may pay for some dental coverage. Original Medicare does not pay for dental coverage. And so you say, well, to Lorena's question, why would you choose Medicare Advantage over original Medicare? Well, because you may be able to get additional benefits. But these benefits are achieved by extracting cost savings in other places. So with Medicare Advantage, you may have to use a particular hospital or hospital system. You may have to use a particular set of providers. You may have to comply with some other, um, I don't want to say restrictions, but some other regulations related to accessing your benefits. Okay. So with original Medicare, I can basically walk into any physician's office, any hospital in the United States that is accepting Medicare and get coverage. But with a Medicare Advantage plan, I may have to use a particular provider or set of providers. And so be very careful in choosing between original Medicare and Medicare Advantage. Some people do it and love it. Some people do it and they don't love it. But you know, if you choose and original Medicare plan, or a Medicare Advantage plan, I'm sorry, you're kind of stuck with it for a year. You can only make a change once a year. So investigate it. Don't just sign up for it. Investigate it, and we'll talk about some resources at the end through our area agencies on aging that can help us make those decisions. Margaret, we'll talk about Medicap in a bit. Liz, same question. Um, so, Schultz, a Medicare Advantage plan offers you, they have to offer you all the benefits entitled to you under Medicare. Okay. So they are offering you all the benefits available under Medicare. You just may have to comply with some additional regulations. And for that, you may get some additional benefits out of your Medicare Advantage plan. All right. So we're going to hop back over to original Medicare because that's the easiest one to talk about. It's basically the same anywhere you go. Um, so Medicare Part A pays as your inpatient hospitalization coverage. Okay. So when you're an inpatient in a hospital or an inpatient in nursing facility care, and please don't confuse this with long-term care. This is more like rehab. So if you have your hip replaced or something and you have to go to a rehab facility, Medicare Part A is what's going to pay for that. It does pay for blood when you're an inpatient, home health care, and hospice care, all available to you under Medicare Part A. Um, Most people don't pay a premium for Part A. This is what you get for working your 40 quarters and paying into your FICA taxes or old age security income taxes, old age health insurance taxes, depending on how it shows up on your pay stub. Most people don't pay for Part A. If you need to pay for Part A, so let's say you've never worked and you've also never married, so you can't draw off a spouse's record, you can buy into Part A, and that's at a cost of $505 a month or so. But most people don't pay for Part A, um, except if you don't enroll during that initial enrollment period, you may have to pay a penalty for a little bit if you don't enroll when you're first eligible. So do pay attention to those enrollment deadlines as they approach and be sure to take advantage of that so that you don't end up paying penalties. In 2024, so if you notice at the bottom of the slide, 2024 is in red. The 2025 numbers have not been released yet. So we'll mention this a couple of times during the session, but um, following this session, when the 2025 numbers are released, one of the first things we'll do is publish a blog post with that information on it, and we'll post it to the event page. So keep an eye out on the event page, over the next few weeks. And when the new costs are out, we'll get them updated. But in 2024, these were the costs. Costs don't fluctuate that much year to year. So I would expect, all of these costs to be within, let's say, $5 to $25 of each other. But that's a guess on my part. But looking back at past trends, it seems reasonable. But just note these are 2024 costs. So for Medicare Part A, this is your inpatient hospitalization. You have a $1,600 deductible and no coinsurance for the first 60 days of each benefit period. And if you think about being admitted to a hospital, you probably reach that $1,600 deductible just walking through the door, right? So don't let that be scary to you. And in a bit, don't you hate it when a speaker keeps telling you in a bit or later in the presentation? But in a little bit, we're going to talk about some programs that can help offset some of those costs for people who meet certain income and asset requirements. And then after 60 days, there's a $400 per day coinsurance up to 90 days. And then after 90 days, it goes up to $816 per lifetime reserve day. So again, these are 2024 numbers. I expect the 2025 numbers to be kind of in line with this, but there's an asterisk on this slide. For your skilled nursing facility care, again, this is rehab. Nothing for the first 20 days, $200 for each of the days up to 100 days, and then all costs after 100 days. And then for home health services, you generally pay nothing except for 20% of the Medicare approved amount for durable medical equipment. So if they have to bring out like an oxygen, or if they have to bring you an oxygen concentrator or a walker or a wheelchair or something like that for you to use, then you'll pay part of the cost of the equipment. Um, Medicare Part B, B as in boy, is our outpatient coverage. So this is if I go to my health provider's office for a routine physical, or if I go there and they draw blood or do an X-ray or something like that. This also pays for durable medical equipment, diabetic testing supplies, and a lot of preventive services. Medicare Part B, B as in boy, is optional. I do not have to take Medicare Part B, but there are penalties if I don't. So if I don't take Medicare Part B when I'm first eligible, I may pay a late enrollment penalty. And unlike the Part A one, this one doesn't go away. Um, so in 2024, again, the numbers aren't out for 2025 yet. The standard premium for Medicare Part B was $174.70 a month. Now, if you are lucky enough to make over $100,000 as an individual or $200,000 as a couple, you may pay a higher monthly premium based on your income. So keep that in mind that that's a base level figure. There are exceptions to that penalty. So let's say I'm 65 and I enroll in Medicare Part A, but my company says, no, no, you don't need Part B. You can stay on our insurance. Medicare will waive penalties going forward if you're able to show that you have creditable coverage. So that is, you had other coverage and you didn't need Medicare Part B. You won't be penalized for that. So don't get alarmed if you plan to uh, continue working past 65. There are some exceptions to how these penalties are assessed. Your Medicare Part B, B as in boy premium is generally deducted from your Social Security benefits. Um, but if you're not yet drawing Social Security, you're going to wait until 67 or 70 or whatever like that. There are payment options available that you can avail yourself of if uh, if you're not yet drawing Social Security. Sorry, I get distracted by the chat. Hold that thought, Marla. We'll talk about TRICARE here in a little bit. Um, the chat sometimes distract me, but don't worry, I'm still here with you. So again, in 2024, the annual deductible for Medicare Part B, B as in boy, was $240. Medicare Part B, you generally pay 20% coinsurance for most services. But there are a ton of services that you won't pay anything. So a lot of preventive health services like an annual physical, routine vaccinations, breast and cervical health services, uh, prostate screenings for men, uh, routine colonoscopies, and things like that. Many of these kind of routine preventive services are available at no cost under Medicare Part B. And so I know you've all seen, you've been to a health fair and you've seen, or maybe your grocery store or your pharmacy, and you've seen free flu shots, right? Well, the flu shot isn't free. They're billing Medicare for it. It just costs you nothing. So a lot of the preventive health services that are recommended to us, Medicare Part B covers at no cost to you. While we're on that subject, though, if if you go to a health fair or go to your drugstore or whatever, and it's a free service, but they need your Medicare card or Medicare number, it is not a free service. Medicare is paying for that. So that is an important distinction, especially if maybe you are at a community health fair or something like that, and they're offering free health screenings. Free is free. If they need your Medicare number, it is not free. It's costing somebody something. So you might try to make that distinction. It's a good way to help reduce waste, fraud, and abuse in the Medicare system, just to kind of clarify um, what will actually be billed to Medicare. There are resources that can help people with limited resources. So these include Medicare savings programs and what's known as extra help. And then Medicaid and Medicare actually do work with each other and talk to each other. And those beneficiaries are known as dual eligibles. And so depending on income and assets, you may actually be able to qualify for both programs. But I'll highlight some of the ones here that may be of most interest. Again, these income and asset requirements are for 2024. The 2025 numbers have not been published yet. But for an individual with a monthly income of $1,275 or less and resources of $9,400 or less, the qualified Medicare beneficiary program will pay their Part A and B premiums. So that's that $1,600 and some change. Oh, sorry, no, the $175 Part B premium, the $1,600 and some change Part A deductible, the $200 and some change Part B deductible, and all their co-insurance and all their co-payments. Okay, so for people who are qualified Medicare beneficiaries, there are basically no costs associated with using their Medicare benefits. For people who are specified low income Medicare beneficiaries, the income monthly income for an individual jumps up to $1,500 a month. Assets remain the same, and that pays your Part B premium. Okay, and then so the $174.70 a month. And same for the qualifying individual. And then you see a qualified disabled and working individual. But notice that the income um, varies. And so I work with a lot of older adults who say, "Oh, I could never qualify. I make too much. Oh, I could never qualify. I own my own home." Ask. And this is where Social Security working with Medicare kind of is beneficial to us in that uh, Social Security, especially if it's your only source of income, knows how much you make, and they can tell Medicare, and you may automatically qualify for these programs. If you don't, and you're struggling to pay costs associated with Medicare, ask. Um, they can't tell you no if you don't ask. And as you can see, there are some variations in income and asset requirements that you may be able to qualify for something that could give you a little breathing room back. But even the programs that just pay your Part B premiums, that's basically $175 a month in 2024. That's back in your pocket because you asked, right? So take advantage of those programs. Um, Resources, Cheryl refers to something that isn't income. So um, typically, and again, this is where it's going to vary by state. Typically, your primary residence is exempt up to a certain amount. A vehicle is exempt up to a certain amount. Like a burial plot is exempt. Burial insurance up to a certain amount is exempt. So it's anything that's not cash or not income. I guess it could be cash in a bank account or a CD or something like that. But there are some big exceptions for that, including typically your primary residence, a vehicle, and then some other things. So with Part D, this is your prescription drug benefit. Part D is also optional, and unlike Parts A and B, Part D is offered by private insurance companies that are partnering with Medicare. So Medicare kind of sets some rules, and then the private insurance companies go out there and they offer these plans. And we're actually in open enrollment for Medicare Part D plans. So if you've got older adults or Medicare beneficiaries in your life that may need to take another look at their prescription drug coverage, now is the time to do it. They have until the first part of December in order to make those changes to go into effect in January of 2025. The Part D costs are out. So this is 2025 information. But That's not very helpful to us because all the costs associated with the plans are going to vary by plan. And so you really do need to do your homework with Medicare Part D. Get on the Medicare website, have your list of medications there, know your preferred pharmacies and things like that, and go on and it'll show you all the options available to you. And for all of the kind of ragging that we do about web-based platforms and things like that, and I just want to talk to a person, this is actually pretty slick and it does a pretty good job. So get on there and give it a try. And if it still doesn't work out for you, again, at the end of the session, I'll give you some resources where you can actually go see a person who can help you craft your Medicare Part D drug plan. But the average monthly premium for a Medicare Part D drug plan in 2025 is expected to be $46.50 a month. Again, this is going to vary by plan. Your annual deductible cannot exceed $590, but there are plans out there that have no deductible. Again, everything is going to vary by the plan. It's just it can't exceed $590. And then again, beginning in 2025, out-of-pocket spending is capped at $2,000. So, your out-of-pocket costs are going to be limited in 2025 under your plan. Similarly, with paying your Part B and Part A deductibles and coinsurance and things like that, there is extra help available for beneficiaries with limited income and resources. And you should be able to find that out when you go on the Medicare website and choose your drug coverage. We've had a couple of questions about Medigap, and so we'll talk about it briefly. Medigap is supplemental insurance. So you noticed when I was talking about Parts A and Parts A and B, there were some costs that aren't covered. So, there's typically a 20% coinsurance with a lot of things under Medicare. Your supplement can help pay those costs. Okay. And supplements are offered by private insurance companies. Um, the good news is that they are standardized across the United States, except in the Commonwealth of Massachusetts and the states of Minnesota and Wisconsin. So if you live anywhere else, all these plans are going to be the same. And Massachusetts, Minnesota, and Wisconsin kind of have their own version of being able to choose your Medicare supplement. In order to qualify for a supplement, you must be enrolled in Part A and B. And these supplements have a guaranteed issue period. So they cannot turn you down if you enroll in the 6 months that start the first day of the month you turn 65. So there's no health screenings, there's no, any kind of determination. They have to sell you a policy if you enroll within the first 6 months of turning 65. It is important to note that Medigap policies do not cover everything. They only pay if Medicare pays. So this is not a standalone type of insurance. It really is picking up what Medicare leaves off. Okay. So if Medicare denies coverage for uh, a zebra trampling. You were on a field trip at a zoo and a zebra ran over you and Medicare denied you coverage. Clearly, I'm making this up. Um, your Medigap policy will not pay. Okay. Now it seems like maybe you could sue the zebra and his or her liability coverage. This is getting too ridiculous. But anyway, um, your Medicare supplement, also known as Medigap, only pays if Medicare pays. And you have to be enrolled in Parts A and B. Think about signing up in the first 6 months because they can't turn you down. The thing to know about the plans being standardized is you can get whatever you want from whomever you want, right? So if I'm interested in plan A, you see that in the far left column, which pays 100% of my Medicare Part A coinsurance, 100% of my Part B coinsurance, pays for some blood, and then pays for coinsurance related to hospice care. I can call any insurance company I want and say, what is your rate for Part A? And I can literally compare apples to apples. Okay. So that is the one of the good things about these being standardized is that you can comparison shop and find the best rate that works for you. But do it in the first 6 months, right? Because then they can't turn you down. Plans C and F are no longer offered, so they're in red. If you're already enrolled in them, then you can keep them, but you can't take in new ones. I want to draw your attention to D as in David and G as in goat. Notice the foreign travel emergency, uh, and it covers 80%. Medicare only covers you when standing on US soil. Okay. So if you are um, planning your retirement dream of living on the beach in Costa Rica, guess what? Medicare doesn't cover you there. Okay. But some of the supplements that are available to you, and this is kind of an asterisk to what I told you about how if Medicare doesn't pay, your supplement isn't going to pay. This is an exception. So um, some supplements do provide coverage for foreign travel emergencies. And that's important if you plan to retire in a non-US destination or if you plan to travel the world as a newly minted Medicare beneficiary, you will need to arrange for some type of additional health coverage or find a supplement that covers foreign travel emergencies because Medicare only covers you when you're in the US. When you feel so to move from a Medicare Advantage to traditional Medicare is not terribly difficult. You just wait for the period we're in now, the open enrollment period, and you can switch back and forth. Um, and then it would go into effect in January. Once you're back with original Medicare in January, you could get a supplement as long as you're enrolled in parts A and B. Um, but for the supplement, you wouldn't be in that guarantee issue period. So you may be subject to medical underwriting, right? Like they may make you go have a physical, or you may pay higher premiums based on certain lifestyle conditions or something like that. So it's not difficult. It just takes some time. But that's a good question, Mary. Couple of really helpful publications. Medicare and You for 2025 is number 10050. If you go to your favorite search engine and type in Medicare and You, it's going to come up though. One that I also enjoy is number 10116, and that's Your Medicare Benefits. And it basically takes away all of the who, how, and what of the program logistics and only talks to you about the benefits to which you're entitled. And they're listed alphabetically. So you can literally start in the A's and go all the way down to whatever Z would be in my hypothetical example before it wasn't a zebra trampling, but um, you can go see what the uh, rates are or what your coverages are. We're going to talk a little bit about coordination of benefits, and I'm going to try to focus on some of the programs that are going to be most interested for you. Yes, Melissa, if you make a change on your supplement, you may be subject to medical underwriting. So that guaranteed issue period is only in the first 6 months, um, the month you turn 65, and then the 5 months after. So there are instances where Medicare may be the primary payer, Medicare may be a secondary payer, or Medicare may not pay at all. And this is all how coordination of benefits works. And so we're going to get briefly on that. So Medicare is generally your primary payer if it's your only source of coverage. And then, it may come into play with Medigap, Medicaid, TRICARE for life, things like that. So Medicare may be your primary payer, and then some of these others will come in and pay um, uh, depending on how their coordination of benefits is tied together. And then Medicare is secondary when it's not responsible for paying a claim first, and that's dictated by legislation. That's helping protect the Medicare Trust Fund, or there's some other service that has been designated as the primary payer. And so this is way into the weeds. Just know that there are determinations in place to know when Medicare pays for something and when someone else doesn't. Medicare is not part of the marketplace. So the marketplaces which were established under the Affordable Care Act um, does not include Medicare, and there are some um, not so good enterprising individuals that may try to enroll Medicare beneficiaries in marketplace plans, but that is against the law because Medicare is a standalone program and it is not part of the marketplace. So be aware of that, especially if you or someone you know is on Medicare and has received solicitations that they need to join a marketplace plan or they're going to be penalized or something like that, it is actually against the law. So, but that doesn't stop people from trying to get people enrolled. Um, Hold tight, Margaret. We're getting there. Um, Coverage offered by employers to their current employees and retirees and spouses, including the Federal Employee Health Benefits Program, may be secondary payers to Medicare. Okay, so I work for the Texas A&M system, and when I turn 65, I'm going to get a nice letter from Human Resources that says, "Hi, happy 65th birthday. We hope you enrolled in Medicare. If you didn't, you need to." Um, and that will pay for my inpatient hospitalization insurance. And then the A&M system will become my secondary payer. So they will kind of pick up where Medicare leaves off, which is also why I don't need to enroll in Medicare Part B, B as in boy, in that moment, because I have creditable coverage. I've got coverage that is as good or better than Medicare. And then when I decide I'm done with the A&M system and I retire and need health coverage, I'll be able to go back and pick up Plan B, Part B, and I won't be penalized for it. Okay. So there are a lot of instances where you may not need Medicare when you turn 65. And there are exceptions for those penalties, and this is one of them. But if you're approaching that 65th birthday, you might want to go ahead and have that conversation with your human resources department or whomever manages your benefits to see what you need to do um, and how Medicare interacts with your employer group health plan. VA benefits, people who are entitled to benefits under VA have to choose whether they're going to exercise their VA benefits at a VA facility or their Medicare benefits as a non-VA facility. I know there are some waivers and other things out there that I'm not at all equipped to talk about under VA where um, uh, VA beneficiaries can receive treatment and services at non-VA facilities. But from Medicare's perspective, if you want to use your Medicare benefits, then you need to use those at a non-VA facility. And if you want to use your VA benefits, you need to use them at a VA facility. And if there are waivers and exceptions, I'm glad for you, but we're not going to kind of go down that rabbit hole because that's getting a little too individual, um, for a diagnosis or a service that may qualify for one of those. But just know that they are separate programs that need to be exercised at separate facilities. TRICARE for Life is the post 65 or post Medicare version of TRICARE. So those of you who will be retiring from active duty service and going on TRICARE for Life, it works very much um, uh, like what I just described, where you're leaving your employer health coverage and Medicare will be a primary payer, and then TRICARE will um, pick up the rest, right? So TRICARE for Life does require that you be enrolled in Medicare Parts A and B. So you have to be enrolled in Parts A and B. And in those instances, Medicare will pay first, and then TRICARE for Life will pay the remaining. Um, Now, there are some services that are covered by TRICARE for Life, but that are not covered by Medicare. In those instances, TRICARE for Life will just pay for those. Um, Up to the coverage limits that they've established. And then for services that you're received at a military hospital or other federal provider, TRICARE for Life will pay, and Medicare generally pays nothing. So if you are getting services at a military hospital or a facility that's on an installation, you will generally um, be using your TRICARE for Life benefits with that. Denise asks a great question. What does a retiree do between age 60 and 65? That is actually a question that I can't answer, Denise. So I know about Medicare, which starts at 65. I don't know about TRICARE and kind of that transition, but we will try to find the answer out, or if we've got somebody on here who's maybe from Defense Health Agency or with TRICARE, then oh, okay. So there are some answers about maybe some options. You might talk to somebody with TRICARE and see what other options they're able to provide you with that. And then just like there's coordination of your health benefits, is coordination of your prescription benefits with all of these plans. So again, if you're covered under employee health coverage, talk over with your human resources department or your benefits manager about what you do with prescription drugs. If you're separating from active duty service, especially if you may be in that gap period that we've just potentially identified, talk it over with them, because you won't be eligible for a Part D plan until you turn 65, and then you may or may not need that Part D plan. So the same penalties that apply if you enroll late can be waived if you've got other coverage. So if you can show that you've had other coverage, then those penalties won't apply to you. Always best to go to the source, right? Like, I know a lot about Medicare. I don't know it all about Medicare. You know who does know it all about Medicare? Medicare does. So check out Medicare.gov. It's come a long way and is actually a really great resource. If you need more information about Medicaid, you can go find general information from Medicaid.gov, but you'll probably end up at your state Department on Health or Department of Health Services or Human Health and Human Services Commission, whatever it's called in your state, to find out more. um, the state health insurance assistance program is uh, a local entity that can help you with all your Medicare decisions. So if you go to that link there, it will connect you with your local area agency on aging that have benefits counselors who can help you evaluate whether original Medicare or a Medicare Advantage plan might be right for you. They can help you evaluate which prescription drug plan is right for you. And they are local in your community. Now, I say local, the one here in the Panhandle serves 26 counties. And so local is relative, but people in the Panhandle are used to driving long distances anyway to get the services that they need. But get in touch with the entities through your state health insurance assistance program if you've got questions about Medicare. And your eligibility. And then if this wasn't enough for you and you want to know so much more about Medicare, the Centers for Medicare and Medicaid Services has a program that they call the National Training Program. And for those of you that are service providers that are working with clients that have questions about Medicare, I would commend those modules to you to learn more about the program, and, you know, way more information about the ins and outs of it than we would ever had time to cover today. So our key takeaways for today is that it's a health insurance program, typically for older adults, but may cover other qualified individuals. Um, but it doesn't cover every cost. There are choices in how you get coverage, and certain decisions are time sensitive, so pay attention to some of those timelines. There is additional help out there for people with limited income and resources, so ask that question if you think that you need extra help. And then, there are structures in place for Medicare to coordinate benefits with other health payers, and then also those carve outs for um, waiving penalties if you had coverage already. And with that, I will turn it back over to Rachel to close us out. And if you've got last minute questions, please pop them in the chat and I will try to address them.
Thanks, Andy. And I know we are at the top of the hour, so I'm going to go through these next slides rather fast. So bear with me. But the biggest thing to look for is in the chat. If you're going to have any questions for today's slides, event materials, or continuing education credits, you can find all that information on the event page, but I also posted my email address, so reach out directly if you have any issues. But today's session on Medicare, we're offering several different continuing education credits. So you'll see those on the slides right now. Social work, LPC, LMFT, case manager, patient advocate, financial counseling, Center for Financial Counseling certifications, family consumer sciences, personal family finance educator. We also have one on there that's new, and I'm noticing it's not listed on here. My apologies. Um, for certified health education specialist. So if you go to our website, you're going to see that as well. It's going to be a new one that we're offering for this particular webinar. Um, Certified Health Education Specialist, if you are interested and you're out there and you're listening, that is a new one for you to take advantage of. Again, I posted my email address in the chat pod if you have any issues. What you're going to need to do is go to the event page. You're probably going to want to refresh that page today. There's going to be a nice purple Continue Education button that's going to pop up. From there, make sure to complete the survey. Follow all the steps in order to receive an automatically generated email certificate based on your selections when you go to that Continue Education button on our event page. This webinar is being recorded. We are going to get a recording posted. So if you have any colleagues that are interested in reviewing the recording or you want to go back and gather any additional information that you may have missed, that recording is going to be available. Give us about 1 to 2 business days for that as well. All right, so join us December 10th. We are going to be hosting a webinar for individuals with disabilities as they transition to adult life in that educational arena. So we're going to be providing some valuable resources to support youth with disabilities and their families as they navigate the transition from Individuals with Disabilities Education Act services to post-secondary life. So mark your calendar, December 10th. That's going to be happening. I'm going to post that link as well on in the chat, but don't be overwhelmed. All of this information is on our event page. Um, as Andy mentioned at the very beginning of the webinar, 2025 data for Medicare has not been posted yet, even though that comes out January of 2025 as far as the new numbers, or it takes effect, excuse me, January 2025. Those new numbers are coming out any day now. So we're going to be posting a blog on changes in costs from 2024 to 2025 in a blog. We're going to make sure that that blog post is linked to our event page. So be checking on that event page for that information. Um, Rhonda, on the event page, you're not seeing a place to get a survey or find the CE code. Can you go over that again? Yes, so on the event page, there is going to be a purple button that says Continuing Education. You may need to refresh your page, but it looks like that purple button is there. Click on that purple button, and it'll take you to a survey to complete. What might be helpful, and I'll go ahead and post this in, oh, Coral already beat me to it. She posted a direct link for the CE survey. So go ahead and click on that link if you can. But again, that purple button is there for CE credits. All right, it's a mouthful. Stay tuned. Join us for any upcoming events, resources, information at oneop.org. We're going to begin to close out here since we are at the top of the hour. Rhonda, no purple button found. Um, if you go right above it, and I'll post this again in the chat link, is that direct link to the survey. All right. Thank you, Andy. Thank you for all attending. Hope y'all have a wonderful rest of the day, and a great week, and happy early Halloween.